two pioneering platforms and operations in both Nigeria and the United States. And they're both dedicated to transforming lives affected by neurological challenges. Through these organizations, Dr. David has developed and refined his signature Building Strength approach, a holistic, science-based method designed to restore resilience in both brain and body. In collaboration with the Nigerian federal government and other partners, his teams have achieved remarkable outcomes across a spectrum of conditions for children and adults, including autism, sickle cell, Parkinson's, Alzheimer's disease, as well as mood and cognitive disorders linked to chronic stress, illness, and injury. Deeply concerned about the global rise of neurological and mental health conditions, Dr. Ajibade has become a leading voice in prevention and education. His work empowers individuals and communities with practical, science-based tools to protect their brains long before disease sets in. He is particularly focused on middle-aged women who not only carry a disproportionate risk of dementia, but also shoulder much of the caregiving burden worldwide. And by equipping this group with strategies for brain and body vitality, he's working to change the trajectory of dementia and related disorders for generations to come. Dr. Ajibade is the winner of several awards and has been recognized in 2025 as an outstanding private healthcare provider and top 100 in health and wellness in the USA. Please join me in welcoming Dr. David Ajibade.
Well, thank you very much, Celinda, and thank you to CMSA and the coordinating center. I guess I better move back a little bit for having me. Can you hear me at the back, or do I need to? I can't pull that up. Let me hold this up a little bit. Which one? This one or this one? Okay. Okay. Oh, I can take it off. How about now? Can you hear me?
You guys hear him back there?
Is it hearing back? Okay, good, cool. All right.
Make sure it's turned on.
Yeah, I'm not touching that. Do you prefer to hold the mic?
No, I prefer to use my hands.
Yeah.
I think I'm part Italian. My DNA. It's gotta be in there somewhere.
Okay.
Okay. Okay. Thank you. I think that works. So I say again, just thank you so much for having me. It's a great honor and a privilege. As Celinda said, I'm very, very, very concerned about the rise in dementia and other it's not just about dementia, by the way, a lot of other brain health conditions rising rapidly all over the world. And women bear a tremendous amount of burden. Unfortunately, when I travel, I speak, I've spoken at pretty much all the senior centers in Baltimore City, not so much Baltimore County, but so I've spoken at some of the top clubs, social events, everywhere, and same answer every single time. When you ask people, if you ask a typical person what they need to do to prevent heart disease or heart attack, they might rather say a few things, and that makes sense. But if you ask them what do they need to do to prevent dementia, you get that same blank face every single time, because people simply don't know. Even those who have taken care of loved ones with dementia, they're scared stiff. I was going to say the wrong word, but they're really scared about it, but yet they have no idea. So it's become a passion of mine to really address this as much as possible, and I thank you again for the opportunity to do that. Everyone knows a cancer survivor, no one knows an Alzheimer's disease survivor. This is not true anymore. You have doctors all over this country, maybe they're not maybe they're not publicizing it, but there are doctors, MDs, neurologists who are successfully reversing dementia. Successfully, these are very well known. Okay. Okay, I guess because I wanted to be near okay. Oh, is that too high? Oh. I know I'm short, but I don't want you to think it's terribly obvious, you know. So there are doctors. So our talk today is going to be about 4 parts. I hope we have enough time for this. We're going to set the stage, the basic fundamentals, what is dementia and how it develops. I am going to say some things that probably your doctor has not told you about or you've not heard about. So if you are upset with me for any reason, where's Celinda at? Back there, take it up with her. She done it. It's too late now. All right, so no, I'm going to make it available. We have pages on our website that have the research data there. So you can just get your phones ready. There's a QR code that I will share. It can take you to everything I say. There's abundant research to back it up. Part two, why women have it worse. Most times they just give you a few reasons, but I can tell you there are about 12 different reasons. What women must do, that's part three. Part four is what women must do to maybe help to recover and hopefully point you to the right resources where you can get help. And then we kind of bring it all together. So the numbers are increasing. This used to be about 7 million, they said by 2030, now it's 8.4. Worldwide, we're looking at close to 150 million probably by 2050. So there's an urgent need, like Celinda said, there's an urgent need to really reach out to women specifically. I know there are a few men here. Listen, I don't hold too much hope for reaching men. Men are just not serious enough about it, in my opinion. Sorry, my apologies to men. I mean, check out all the different, when you have webinars on health and wellness. Can I go ahead and admit this person? Mm-hmm. Okay, I admitted somebody. Is that
Yeah,
okay?
perfect. Thank you. The more people spread the message, the more people, the better.
Okay, deal. So a few stats here. Dementia is #1 cause of death in the UK. It's number one among women in Australia. It's number 2 altogether. It's rapidly rising in this country. Women again bear the risk. Everybody knows that Baltimore City is #1 in the country, right? Everybody knows that, right?
No.
Okay. All right.
I didn't know that.
Baltimore City is #1. Maryland is #1 statewise. Terrible. Of course, it's the financial burden. You all know this. I'm just it's kind of like care. What do you call it now? Housekeeping. Yeah, housekeeping information. It's rising rapidly, but it's not just the financial burden. I mean, I know of several cases that you probably know too of caregivers who either died before or soon after the ones that were taken care of died, or they came down with some disease or illness. I know of a personal friend. His father died two years ago. His mom, first of all, had a fracture while she was taking care of him in the shoulder. Later on, now, soon after he died, she came down with leukemia. So now she's being treated for stage 4 leukemia. This caregiving it takes a huge toll on the brain and body of the people that are trying to take care. I mean, there's a lot of grief, a lot of loss, a lot of depression going on, and that harms the body tremendously. So there's also a need to really address the needs of caregivers themselves, because I feel they're being lost in the shuffle. The numbers are not too good. The next 35 years, 1 million to rise to double is particularly going to be bad amongst Black people. It's going to be triple. So Black women in particular going to have the highest, unfortunately, highest risk. Initially, when I reached out to the Alzheimer's Association, I was particularly focused on the Black community because it seemed like we were getting the short end of the stick. And I'm not just talking about institutional racism or being left out. I'm talking about the fact that genetically and lifestyle factors, lifestyle-wise, there was a huge amount of mismatch. I just felt we were not telling Black people about our higher genetic risks of getting dementia, and our lifestyle factors too, in addition to the environmental factors. But I found out that what's happening among the Black community is nothing compared to what's happening with women. You all have been given the short end of the stick. There's no other way to put it, and I'm sorry. Did I say that if you don't like what I have to say, Celinda's back there? Did I say that? But this is the truth. We're now beginning to turn things around. Now there's a lot of women who are coming out and rising up, but it's far too few compared, in my opinion, that needs to be addressed. These women need to be reached now. Now that they're in their 30s, I dare say college kids need to start understanding these things. All right, so these are the big three. In my opinion, well, it's not my opinion, this is the fact. The three groups of people that have the highest risk, or twice the risk as the rest of the population: veterans, women, and blacks. Twice the risk. Okay. Now, since I belong to two of these categories, I'm very, very concerned about this. And just in case someone is wondering, I'm referring to the fact that I'm black and also a veteran. Sometimes you gotta point these things out. Especially, I mean, Nigeria, it probably wouldn't be a joke, right? They'll be like, what, does he think we're stupid or something? But over here, it's probably a little dig, I think. My apologies. All right, so I guess I'm giving you enough news, enough bad news, so I'm just gonna skip this. But the need is that we have to teach women, especially women who are approaching menopause, and I'll explain that in a few minutes, how to think, how to be more aware of their bodies, how to engage with their healthcare professionals, how to insist on certain tests to be done. Don't let them just brush you aside and say it's not important. There are certain things that women must know and insist upon in order to safeguard their brains. All right, so let's quickly, I'm just going to give you a background on dementia. I run a foundation, as Linda said, I treat people with dementia. We're quite successful at it. Also strokes and other brain conditions. We do not use medications at all. I have nothing against medications. I'm a doctor. I'll be 30 years as a doctor in 2 years' time. So I greatly respect our forebears, medical doctors and all that. What we had to learn how to do in a third world country with limited to no resources was look for things that did not require tests or healthcare professionals or experts or institutions. Now, some of you would think that that's impossible. Well, we had to figure it out. And everything we use, as she mentioned, our philosophy is, what does the brain and the body need to be strengthened? Because if you strengthen and support the brain and body in turn will repair itself, fix itself, heal itself, and regulate itself. The problem with modern medicine today is that we give too much attention to modern technology. And in so doing, we neglect the basic fundamental principles of life. And so we had to go back to those basics. As a doctor who was practicing both in the US and Nigeria, when going back to Nigeria about 15 years ago, we had to go back to the basic principles. How does the brain work? What does it need? Are we giving it what it needs to work? And how can we find those things it needs so that we can present it and provide it with the things it needs so that it can do the work it was designed to do. Now, obviously, there are limitations. I mean, if someone has had a major stroke and they have been down for a while, it's a little bit harder, maybe a lot harder. Or if you've lost your kidney or you have severe complications. But it doesn't matter what it is, there's always something you can do. Say that with me. There's always something you can do.
There's always something you can do.
Okay, let's try again. There's always something you can do. You can improve by 10%, 25%, 30%. I promise you that's possible. All right, so let's quickly talk about this. This is what the Alzheimer's brain looks like. That's on, well, I always get this wrong. Which one's on the right? The shrunken one or the others? Which one's the right one?
Shrunken.
Depends on which way you're looking, right?
Yeah, okay,
For you, it's the opposite.
Exactly.
So for us,
I always get it wrong, so which one?
the Alzheimer's on the right here,
Alzheimer's on the right.
and the normal's on the left.
Perfect, because I would have said that the opposite.
Because you're standing the opposite way.
That's right. You're smart.
Look at that.
Look
At that.
you. Look
That's
at
why
you.
they sit me in front.
Nothing wrong with her brain.
That's why I'm in front, yeah.
I love it. All right, so by the time a brain has full, by the time it's full blown Alzheimer's disease, you have lost, the person has lost. We're very superstitious in Nigeria, so I don't want to mention you in particular, but the person, individual with Alzheimer's disease, has lost over 30% of their brain tissue. That's a lot of brain tissue. So it's not just a psychological thing. It's not the kind of thing you counsel people out of. It's a structural defect. So the basic definition of dementia is a syndrome involving decline in memory, thinking, and behavior, and the ability to perform everyday activities. You may have perfect memory and still have dementia. I hope you know that. It's about 3 or 4 out of 5 things. So some people just have problems thinking through, maybe calculating a tip, navigating, or doing things in the right sequence. Toothpaste on toothbrush, put the toothbrush in the mouth and brush the teeth. That may be very tough for some people, but they may have perfect memory. So dementia is a very broad umbrella, over 100 different kinds of dementia. There are some that are known as irreversible, there are some that are reversible. Alzheimer's disease tends to fall in the former category, and it holds about 75 to 80%. 75 to 80% of all dementia. Some say 60%, but I think it's larger than that. And the general definition is that it's a progressive thing. It causes irreversible loss of neurons and synapses. We will explain that in a minute. But the hallmark, obviously, as everybody has heard about, are the amyloid plaques and the tau tangles. That's what makes Alzheimer's disease what it is. And so that's why the entire focus of treatment is on removing those plaques and tangles. How much has been spent on that? $30 to $100 billion. How much of that has been successful? I really can't tell you, because a lot of money is being spent, but it seems to me that if we had spent that much money on any disease, we should be getting some success by now, right? Okay, all right, so your mission really is to ensure that this on the left does not become this on the right. Fair enough?
Yeah.
That's your mission. It's not my mission. It's not your partner, your loved one. It's not the government's responsibility. It's certainly not God's responsibility. It's your responsibility to know what to do and what to stop doing to ensure that your brain is preserved into your 90s and beyond. My mission is to help you know what that is, and then we are on our merry way. All right, and the idea is to make it clear and simple. So that's what we're gonna. I'll skip through this. And so I've said a little bit about myself. We started about 10 years ago, 2015, and I still run a clinic in Nigeria, but we decided many years ago to devote a day of the week to focus exclusively on the poor, those from low income who could not do anything. I mean, we had barely money for transportation. So they would bring their kids with cerebral palsy and any neurological condition. Eventually, it included sickle cell disease, because, by the way, I know some of you know what sickle cell disease is. Sickle cell disease is primarily a black person's problem, and which country has the most number of black people on the planet? Does anybody know? Nigeria, 200 million to be exact, all blacks. All right, there were years I went by without me seeing a single white person. So this is really scary, just looking at all you white faces. Intimidating, tell you. I'm just acting up to make you feel like I know what I'm talking about. All right, so that's what we did. We started learning, what can we do to help these people, these problems. We found out that, like I said, we couldn't do tests, we couldn't give standard medications. We couldn't send them to the physical therapist, we couldn't send them to the occupational therapist, the speech therapist. All we had were nutrients, supplements, we knew that the brain was made up out of certain things. The brain required certain things, and we found ways to provide these young brains with the raw materials and resources that they needed. And again, it had to be safe, and it had to act quickly. If it was not working within a week or 2 weeks, these patients would not come back. Right? So it had to work, and it had to work quickly. So that was our whole philosophy. And in the process, we had a lot of success. We had a lot of different, the government got involved, we won awards and so on and so forth. But the way we learned, and we had to process this over time, we would have to come, I would be traveling back and forth from the United States, learn, do courses, meet with mentors, get supplies and so on. And so we got a lot of success. One of the things that really stood out and that we had to learn, that we learned was, we learned how to push the brain harder and farther than we thought was safe, and we thought was possible. And this perfect example is this kid. She was one of our first patients. She had a problem with her pancreas, so she came in with insulin-dependent diabetes. So she needed insulin. Mistake happened, medical mistake. The nurse gave 100 times to a 2-year-old. Fried her brain, completely fried. So, but she still lived, she survived. And when the mom came in with her, she was extremely stiff, almost hyperextended. The back of her backbone, her back was like bent backwards. So she was like the toes and the back of her head were like stretched, like concave, right? Concave, convex. Anyway, I honestly, I wasn't sure what to do there, but I knew that omega-3s were very helpful. We had just gotten some from a very well-known doctor in Boston whose whole thing is omega-3s. So he had been able to create the right concentration. Now let me just say this: for a kid that small, maximum 1 gram is what the doctors recommend. I asked them to give her 3 teaspoons a day. That's about 7 grams. So it was much higher. She thought I said 1 tablespoon 3 times a day. So she gave her kid pretty much 30 times. Are you seeing a pattern here? Comedy rolls. So, but that's what did the trick. I would never have recommended 3 tablespoons. Even at 3 teaspoons, that was a risk. Anyway, she came back. Mother used the word magic and showed how the kid had now almost completely straightened up, was smiling. She was in severe pain all the time. The kid was now smiling, more aware of her circumstances. That clicked in my mind, and I was like, listen, maybe we've been doing this thing wrong. Maybe we need to start pushing further and harder. And that's how we began to learn how to address these different things. Sickle cell disease began to come, cases of strokes from sickle cell disease. We joined the military, we got a military veteran. We took some of these support structures, these nutrients, went to the military. Our Walter Reed, we had dealt with things like TBIs, PTSDs, depression. It worked for almost everything we tried to. Almost everything. Now, I'm not saying that they became 100% better, but we significantly improved their mental and physical health. The only thing that we had trouble with was dementia. And I'm going to explain why that is so in a minute, all right? But I'm going to define to you our working definition. I'll give you our working definition of dementia. And essentially, dementia is the brain saying enough. And it is shutting itself down. It is pulling back its connections and shutting itself down. How many of you have heard that definition before? It is the brain, and after a certain point, it's the brain that is doing this to you, or doing this to the individual. Now initially, there are a lot of things going on, but when it gets to a certain point, the brain shuts itself down. And so if you're going to find a solution to it, you've got to find a way to convince, coax, coerce, nudge the brain to stop doing what it's doing. Okay, I can see the people looking at me like, Celinda, what did you do? All right, so let's get to basics. I'm going to explain in a minute. For us to really understand what is going on in the brain. There's another one. Just going to admit that one too.
Yes, please.
All right, absolutely. So let's start at the beginning. The brain is made up of brain cells, neurons. There are about 86 billion, and all these brain cells are connected to each other by what is known as synapses, so the nexus. One brain cell can connect to as much as 40,000 different neurons. So overall, in the whole network, you have about 100 trillion connections. I mean, I don't know who got the time to actually sit down and count those, but I don't doubt it. I'm not going to try and count and prove yay or nay. So we just take their word for it, right? So there are 100 trillion connections, and these connections, this is how your brain works. Your brain works by forming new connections and pruning old ones. Your heart works by pumping blood, so it beats and it relaxes. It beats and it relaxes. In the same way, the brain, the way it does everything, from listening to you, from you listening to me, to writing down, to digestion, to breathing, your brain works by forming new connections and pruning old ones. It's kind of like a network, a marketer, a supermarketer, for instance. The way that the marketer or the salesman is successful is by always being out there and forming connections and then getting rid of connections that don't serve the individual. As it is without, so it is within. People, the healthiest people, the most successful people are the ones who have great quality relationships. The number and quality of the connections your brain has, the more healthy and the more powerful the brain is. For the brain to be healthy, it must be constantly making new connections and pruning old ones. I know I'm emphasizing this, but that is where it's at. If anything gets in the way of doing that, then you will suffer to some degree. And this man typified it. His autopsy revealed that he had significantly greater connections in his brain than the average person. And that's why he was so effective and made so many discoveries. Some of it is genetic, obviously. Others is just basically hard cold, just working and grinding and making those connections happen. But the problem is the problems with having so many connections is that you need energy to maintain those connections. That's where the problem lies. If you don't have enough energy to sustain this network of 100 trillion synapses, things will begin to go wrong. And what we're beginning to find out is that decades before a person has the first symptom of dementia, memory loss, cognitive problems, and so on, sleep problems, their energy supply in the brain had been diminishing. Maybe they didn't notice it, but it had been happening. And so this is a new field now where they're looking at the network instability as a result of energy deficiencies. And some of it shows up in things like, and I'm sure if we did a count now, some of you may relate to some of these things. Glitches, senior moments, memory blips, mental lapses, wires crossing, like these things happen to individuals who don't have dementia, especially as you grow older. Obviously, it becomes dementia when it really interferes with your daily life. Okay. Difficulty following a conversation. This one in particular is interesting to me because there's a psychiatrist I know, her first symptoms was that she would go out and she would be in with a group of friends, maybe at dinner, and they would all be talking and she would find it difficult to follow their conversation. She thought there was something wrong with her hearing, so she had a audiologist test her hearing, 100% perfect. Later on, she found out she was diagnosed with early stage Alzheimer's disease. Fortunately for her, she found doctors who were treating dementia. I'm talking about MDs now, I'm not talking about quacks. about MDs who are working in very established institutions like UCLA, and she was able to reverse her dementia. Now, her whole thing is that she's in collaboration with these doctors. She's treating successfully dementia. All right, so let's summarize. The parts of the brain most affected in Alzheimer's disease seem to be the parts that have the greatest synaptic density, that's most connections, or they also, and it's pretty much one of the same place, it's at the same places. They have the highest energy use because the greater the greater the network is, the greater the number of connections, the more energy is required to maintain those connections. All right, I usually ask this question, which is more important to your brain? Remembering how to breathe, or remembering your spouse's birthday, for instance. So which is it?
Breathing.
That was quick. I was at a dinner, one annual conference. I asked the same question, and I was about to go to the next slide because nobody said anything. So I finally looked up. I was like, did they not hear me? Did they not understand my accent or something? And then finally, a guy in the front table says, like this. I'm like, guys were afraid to speak. Nobody wants to go home and get in trouble, right? I hear ya. So I was like, oh, golly, okay. I went to a predominantly black church, and I asked the same question, and like you, they answered right away. And I was like, yeah, of course, okay. So it's not all Americans are crazy then. Maybe just the white ones. Just kidding. Please. I promise I'm kidding. No. Maybe not. No, I am kidding. So the obvious question is, what drains? If it comes down to energy levels, and it does, we need to understand that, in my opinion, the priority of research should be on how to maintain brain energy levels and how to increase it and what drains it. I mean, does that seem like a simple, straightforward thing to ask? I mean, what could be more important than that? If it all begins with energy depletion, then our priority should be on what can we do for the average person to ensure that they maintain high brain energy levels throughout life. What could be more important than that? All right, so let's talk about, so obviously the number one thing is aging. As the older you get, unfortunately folks, yep, it happens. The older you get, the less brain energy you have. And I'm going to show you a graph in a minute. So at 25, can you see my cursor? You see my cursor? No?
Yes.
Okay, right. So at 25 is full brain development. That's the part of the brain that has to do with judgments and decision making. That's the prefrontal cortex. That's when it comes online. And as I was saying this at another place I spoke, this was a financial firm, and someone just rudely interrupted me and said, yeah, that can't be right. Maybe for women, yeah, it's at 25, but for men, it's more like 40. I mean, there's always some smart aleck in one group or the other, right? All right, so menopause, 40 is when things you begin to notice things slow down, as you can all testify. 50 is menopause. A lot of things happen during menopause. And we'll talk about that a little bit. And then 65 is when it's official Alzheimer's disease happens. That's when it's most likely to happen. So anytime before 65, it's called early onset dementia, and anything after Alzheimer's disease is later.
Sorry.
It's just called dementia. All right. And again, like I said, these are the three categories of people who have the highest risk. So we can learn a few things. We can learn a few things from why these groups of people have such higher risk. For veterans, obviously toxin exposure, head injury, isolation, not having lost their maybe compadres in war, and
leaving deployment and then retirement and getting into the real world, so to speak. They're not accustomed to the way the real world works, and they get isolated and so on and so forth. So that increases depression levels and therefore dementia. These mental illnesses, by the way, they are a gateway drug for dementia. Depression, anxiety, all these different things, they weaken the brain over time. All right, so with blacks, we are the kings and queens when it comes to cardiovascular disease, and over 80% of dementia, I would say more than that, has a cardiovascular system component. So we tend to have a lot of that, whether it's hypertension or diabetes. We also tend to have some key nutrient deficiencies. Lifestyle factors play a role as well. For women, it's menopause, obviously. Tend to have greater rates of certain kinds of mental health conditions. And many people don't know this. There are nutrients that your brain must have that many women are deficient in. No one is telling you people this. Many women are deficient in nutrients that are absolutely vital for brain function. And you're just not getting them. All right. So this is the graph I was talking about. So this is in your 20s, 20, 30, 48, all the way to 90. So over time, beginning at 100% brain energy levels, you can see that decline. For men, that's the blue line, as you can see in the legend. For women, this is very interesting. So there's also a decline where women are concerned. In some cases, at menopause, you can have as much as a 30% drop in brain energy, especially in certain parts of the brain, like even the memory centers. Now, in some cases, in most cases, fortunately, you're able to adapt to that drop in energy levels and learn how to live with it. And sometimes those energy level returns, not to what it was before, but at least it gets back. Now, I can't see, let me see, there's something right, so let me move this over a little bit, there you go. Okay, so you can see at 90 is probably about 65% for both sexes. What you don't want to happen is for it to drop below 50%, and I'll explain why in a minute. Okay. Or maybe I can do.
Yeah, minimize.
Just minimize it, right?
Okay.
Yep.
Or even less than that too.
Hit that one. There you go.
Boom.
And I'd move it over that side.
Move it over that side.
Yeah.
Okay.
There you go.
I didn't know what you meant by that side, but I guess.
That's there. That's why I pointed.
Okay.
That's why I pointed.
All right, so I love I gotta finish this spot up. I love the Alzheimer's Association definition. It is a degenerative brain disease that is caused by complex brain changes following cell damage. That is the key right there, folks. It leads to dementia symptoms that gradually worsen over time. Have you noticed what they did not say? They did not say that it's a degenerative brain disease that is caused by amyloid plaques or Alzheimer's. But yet that's what everybody is meant to believe, that is caused by this. I know I can get in trouble for this. Like when somebody walked up to me after one of my talks and they said like, do you have security? And I'm like, I'm from Africa. We're tough, we can handle ourselves. Well, who cares about? So I kind of mouthed off a few things. And a few minutes later, somebody pops a balloon behind me, and boom! I'm under the table, man. Like,
Oh my God.
golly, God, nobody said anything about balloons. You know? That was something that you would have been proud of me. I mean, like really fast under the table. All right, so here's the Dementia's Dirty Dozen. So I came up with this. This is from, yes, ma'am.
Let me get a mic.
Do you mind if I ask a question now, or do you want us to wait till later?
If it's short enough, if you can do it briefly, yeah.
Pretty short. I was just wondering, how do you measure brain energy? No? How do you measure brain energy?
So, great question. So there are special radiological investigations where they look at how much glucose is being utilized by certain regions in the brain. So it's basically two things: glucose uptake and blood flow. So if certain parts of the brain are using more blood flow, it means that they are utilizing more energy. And then glucose, they have a way to radiologically tag glucose and other nutrients, and the way it's taken up but that part of the brain is an indication. So there are surrogate ways they use to measure brain energy.
So wait, do you put electrodes in your brain? Is it a blood test? I don't get
It's
it.
like a CT scan. So they inject your blood
Uh-huh.
with certain kinds of dyes. I mean,
Okay.
it's nuclear medicine, so to speak.
Okay.
And
Probably
then
the
they,
equivalent of a PET scan.
so they do a PET scan or a CT scan or an fMRI, and they look at the brain
Oh.
as you're thinking or as you're moving or whatever it is, and they see how the glucose is taken up.
Okay. Thank
Okay.
you.
I believe they do that with oxygen as well. Anyway, I hope that answers the question. So these are the 12, I call them Dementia's Dirty Dozen. Now, again, folks, I'm coming at it from a practical perspective. I treat dementia and other brain disorders. I have a perspective. I have perspective in that I can see things that happen in kids, and I can compare with adults. And so basically what I learned from working with kids, I apply to adults. Sometimes what I learn from adults, I apply to kids. And there's been no roadmap, quite frankly. Like I said, it's like wild, wild west where I work and live. So we had to figure these things out. And again, this is not going to be kosher. It's not going to be what is in the textbooks or the protocols that have been established by the AMA or something. I'm just telling you what we found works. And I'm hoping that as we talk about these things, you will be given tools that you can use to practicalize that. That's the whole idea behind what we're doing. And we're not trying to convince you when I speak to doctors, I'm not trying to convince them to change their treatment. My focus is on lay people. What you can do. You don't want to wait 10 years, 20 years to find out whether they've done some major research to prove whether I'm right or wrong. That just wouldn't be smart. These are simple things that you can do right now, beginning today, to change. So, like I said, these are 12 things that so there's I believe, I'm just going to run through them. Illnesses would include cardiovascular disease, injuries would include strokes, CTE, everybody knows what CTE is, football injuries, for example. Trauma, this could be emotional trauma, it could be physical trauma, so injuries results in that. Insults, mostly toxins, whether in the environment or in the homes. Everybody heard about mold toxicity, right? Microplastics is becoming a big thing. Inactivity, the brain requires movements. The brain also requires mental activity as well. So if you're not doing those provide some kind of vulnerabilities. Insufficiencies refer primarily to nutrients, but also to other things. Imbalances is another big issue. Sometimes you might have things in the right amounts, but the balance may be off. A good example is between zinc and copper, inflammation and anti-inflammation. Insulin resistance is a big one. Intestinal dysfunction, if your intestines or your gut is not working well, it's not going to absorb the food that it needs. There's a one-to-one correlation between the brain and the gut. Everybody heard about the second brain. Does that sound familiar? Very important. Infections, big time. COVID-19. Ever since the pandemic, a lot of people who have had severe COVID or who have lost a sense of smell tend to have a higher risk of coming down with dementia. Insomnia, big one. Sleep is so important for forming memories. Isolation, obviously, that's self-explanatory. Immune dysfunction, another big one. I believe there's a QR code here. If you want it, you can just take a picture. The QR code, I have an ebook, free ebook, where we explain each of them. And it's out of this list that we're going to talk about why women have it worse. So when I had this framework, I was not able to apply it to blacks, to soldiers, to veterans, and to women. So everybody got that? We'll move to the next one. All right, so let's wrap this up, this first part, too much time. So what the Alzheimer's Association is saying is that damage eventually leads to dementia by way of the brain trying to compensate, to correct, to fix that problem. So in the process of trying to fix these problems, eventually it happens. So this is Dementia's Dirty Dozen up here. one or more is never, in my opinion, in my experience, is never just one thing. So these is a pylon, so to speak. Things happen at different stages in life and they affect the brain, cause damage and dysfunction. The brain tries to fix it. Sometimes treatment is given that may make things worse. Medications are not always perfect, you know what I'm saying? Sometimes the brain actually gets upset. There are certain cells in the brain that get triggered and cause more damage to the brain. There's constant attempts at recovery, causes further damage, and it's like a vicious cycle. This has happened over decades, 20, 30 years. Eventually, because of all the stressors and everything, the energy levels, remember that graph I showed you, it goes less than 50%. At 50% is known as is what is called MCI, mild cognitive impairment. Does anybody know what that is? Everybody should know what that is. No? Yes? So mild cognitive impairment is the stage before dementia. The person is clearly having symptoms. The person is clearly compromised. However, they can still function. They can still live somewhat independently. They can still, I had a patient who was driving his car and going to golf courses. Meanwhile, communicating with him was a problem. But once it's full-blown dementia, that's when independence is lost. Okay, and that's what you have it. Make sense? All right, so I'm just gonna quickly wrap this up. I mentioned that we failed initially. The reason why we failed was because we did not address the energy part of the equation. We were trying to fix the damage, we were trying to repair the brain structure itself, but we did not address energy. Once we fixed that, once we learned how to fix that, then things turned around. There's another QR code. This has the research pages where, I think I might need some more glucose, I don't know. It's hard work sitting out, standing up here giving a speech, I gotta tell you. Oh, man. All right, so this has the page, kind of like gives you references and all that. All right, so I'm just going to end with our stories. I'm going to give you a case study. We have several that we treat and are treating. So this is our philosophy. This is how we treat. So as you can see at the top here is energy. We focus on restoring energy, but we also address blood flow. The brain support refers to the whole nervous system support. Hormones play a huge role, and we'll get into that. Immune support, gut support, detoxification. We have to do everything, in many cases, all at once. So when I have patients, we get the different nutrients that affect these different things. We ship them to the patient, and we get them started maybe on 2 or 3, and then as they are able to tolerate, we increase the doses and increase the doses. So I'm constantly in talking and in communication with the caregiver who is administering these supplements. This lady, for example, she was almost bedbound. They had to feed her. She couldn't move herself. She couldn't walk. She couldn't recognize her son, who eventually called me. He sent me his MRI scans. I mean, the first thing I saw was global cerebral cortical atrophy. Basically means the brain had shrunken significantly. Okay, so I honestly didn't need to look at anything else. I'm like, what do you want me to do with this? Why didn't you reach out to me sooner? Anyway, bottom line is that like I said, we started addressing all these different things. Within a week, we already started seeing improvements. She could not walk, like I said, she was bedbound. Within a couple of months, he sent me a video. So he has this camera on his mom at night because he's out of the country a lot. So he sent me a video of his mom getting up at night to use the bathroom on her own without support. They've sent me several videos from then, her recognizing her grandkids and others, her walking by herself, sometimes with support. Part of the problem is that she's still a little afraid and uncertain, so she's a little tentative, kind of like a baby trying to walk for the first time. The muscle mass is there, the ability is there, just not sure. But we're getting there, so very, very important. What really matters, I have this acronym, Boise. I just couldn't think of anything cooler, but it refers to 4 things. 4 letters refer to blood flow, these are the fundamental things that I'm particularly concerned about, and I think anybody who is concerned about dementia and treating dementia, they should be concerned about these things: blood flow, inflammation, synaptic activity, and energy production. These are the big four. I would call them the four horsemen, but that's just, it's become such an overused term, so I have to figure something else out. So that is our first part. I hope we've laid the groundwork and the foundation for what we'll be doing in the next few parts, why women have it worse. And I think by this time, you probably have an inkling, maybe a few ideas about why women tend to have it a little bit worse than men do. Yes, no, maybe? You want to wait until I actually spell them out. All right, so do we need to take a break here, or do we just keep going? Keep going, okay. All right, so why do women have it worse? Obviously, there are three main factors for anything: genetics, lifestyle, cultural, environmental. Unfortunately, the three commonest reasons I hear of. Could you mute yourself, please? 443-857, thank you. The three commonest reasons I give are age. Women tend to live 5 to 7 years older than men do, so obviously there's more exposure to whatever damage or attacks they're experiencing. Number two is menopause. So at that age of 50, things kind of like happen. And of course, estrogen levels, which is connected to menopause. Very, very little is mentioned about lifestyle. It's almost like the powers that be, or the authorities, or the researchers don't want to, I don't know, maybe they don't want to make ladies feel bad, but I believe in giving people all the information, right? We need to stop cuddling women, or cuddling people in general. We need to give you all the information so you can make your decisions about what you need to do. All right, so I came up with this acronym, so it's called A Woman's Diet, and yes, every letter stands for a word. Here they are: age, work, or lack thereof. Now, it doesn't apply as much during in this 21st century, but for a while, women were not allowed to work, as you know, and maybe women chose not to work to take care of the family and the kids. That in certain conditions, certain situations, that could be a problem. Osteoporosis is a big one. Menopause, muscle mass, mental illnesses, autoimmune disease, nutritional deficiencies, sleep, digestive problems, illnesses, eating disorders, toxins. We cannot go over everything, so I'm just going to pick and choose certain ones. Which one stands out? So let me do a quick poll. Which one stands out to you? Just shout it out.
4, 6, 7.
4, 6, 7. Love it.
I'd
Yep.
like to know more about osteoporosis.
Okay. All right. Does anybody know that white women have it worse osteoporosis than black women do? Does anybody know that? Significantly worse. Significantly worse.
I think 10 is good too.
10 eating disorders. Okay. All right. Thank you for that. Okay, so let's talk about osteoporosis. By the time most women are told to worry about bone health, they've already lost up to 20% of their bone density. Okay, once you pass menopause, you are 5 times, think about that. You're 5 times more likely to die from a fragility fracture than from breast cancer. Following a fracture, over 25% of people will die within the first year. I was trying to get a picture. I apologize. I was going to get a picture that showed a bone fracture, but you get the picture. Most very severe bone fractures happen in the biggest bone in the body, which is the femur, right? The hip bone, right? It's not just the breakage of a bone. What happens when someone has a fracture is that it's a shock to the entire system. Now, if she's in her 70s and 80s, there are already vulnerabilities in other parts of the body, metabolic included, including the brain. That shock, she may have just been managing and teetering over on the edge. But once that happens, and then they admit her in the hospital, which now results in loss of muscle mass, because once your immobile for a few days to weeks, they can now measure significant loss of muscle mass. And so it's a series of things, and of course it affects the brain as well. But we know, so the brain is not just a structural maintenance of the human body and posture. It's a very active metabolic organ. If the bones are weak, the brain will be weak as well. Some of the reasons we've given here as well. Whatever affects the bones affects the brain. So one of the top things, and I'm going to get to it later on, one of the top things we always recommend is that a woman should be on some kind of supplement that improves bone support. That's why we always recommend vitamin D3 and K2. D3 raises calcium blood levels. K2 drives calcium into the bones and makes the bones stronger. In places like Japan, the standard of treatment is high dose vitamin K2 for osteoporosis. Does everybody know that? Vitamin K2 is extremely important. Now, in addition to that, you want to do, especially women, because you tend to have a greater, and that's, I'm going to talk about menopause in a minute, but because estrogen is one of the top things that strengthen the bones and the brain, that drop in estrogen levels around the time of menopause is one of the risk factors that lead to osteoporosis, okay? So here we are. So here's a graph. Here's a picture here. Let's make sense of this. All right. So where estradiol is the primary kind of estrogen, the most important estrogen, that's the red line up here. So you got peak levels at the age of 20 all the way to 40. It begins to decline. You can see the red line declining, right? Okay. It really drops. The other thing that drops too is progesterone, and it drops even further than estrogen levels. Now, a lot of doctors just focus on estrogen. Progesterone is also very important, and there's something called estrogen dominance. Raise your hand if you've heard of estrogen dominance. Okay. So this is more like in the lifestyle medicine field. They now begin to compare. So you can see that estrogen is significantly higher than progesterone here, right? You can see the red is higher than the yellow parts. That imbalance is what is responsible for some of the menopausal things that people go through, like the hot flashes, night sweats, sleep problems. In fact, progesterone is more important for sleep than estrogen is. So many times I shudder when I see people, doctors talk about menopause and how to treat menopause, and yet they leave progesterone out of the equation, because it's very important as well. Let's see what else is here. So testosterone too is very important, especially for libido and physical strength and muscle mass. This also goes down. So these are things, this is kind of like a picture of what happens from perimenopause onwards. These are things that your brain is used to having and your brain must have to be healthy. And many times, people experience all these distressing symptoms: brain fog, sleepless nights, irritability, anger, depression. And it's as a result, and they are just passed off. The doctor just says, oh, it's just in your head, it's a psychological problem, you'll get over it, and something like that. This is unfortunate, and another thing that's made this so bad is what is known as the Women's Health Initiative. That was a study done 20 years ago when they basically demonized hormonal treatments because they thought it led to cancer and other conditions. Now they're going back and they're seeing where they were wrong, and they are now reversing course and now saying that hormonal treatment is really important. Well, fortunately, a lot of people have suffered as a result of it. Some have died because they did not have the support. You can see again, this is what your brain needs normally to function. If you're not getting enough of it, then you've got to find out a way to get enough of it. It's as simple as that. Now in my country, we don't have access to HRT specialists. Even here, quite frankly, only 1 in 5 OBGYNs know how to do what I've just talked about. Only 1 in 5. So a lot of people are left by the wayside. I had to figure out a way to help the brain and the body make these things in the right balance. So we help a lot of people with menopausal issues, but again, it has to be done. You cannot therapy yourself out of it. Maybe you can manage with it, but the brain needs what the brain needs. So do the bones. So do the cardiovascular system. All right. So I just have a few. You can get these from the slides. Basically, what happens that the declines in different areas. Same thing with estrogen. Estrogen is it's not just a reproductive sex hormone. It's important for the brain, it's important for the bones, very important for the bones. It's important for giving that collagen, that fullness to the skin, right? This is all we know. Most people just think estrogen just helps with the reproduction. It helps with metabolism. It helps with fat distribution. See, the estrogen is what keeps the fat away from your belly and pushes it to the thighs and to the butt, right? Making it look great. But once the estrogen levels drop, okay. All right. Listen, I'd rather you. I mean, I could get in trouble for this, so please don't laugh. I'm just kidding. So the belly fat is a really bad thing. And belly fat is one of the main issues that we're concerned about when it comes to inflammation and cardiovascular disease and brain disorders. And so estrogen again helps to it diverts body fat from the belly. Okay, so this is another picture. This is what happens when estrogen levels diminish. And of course I talk about progesterone as well. So let's go on to muscle mass. Why muscle mass matters. Anybody heard of Gabrielle Lyon? She's a doctor who's really brought to light the importance of muscle, the connection between having strong muscles and brain health and metabolic health as a whole. And she's pointing out that it's not a fat problem as much as it is a muscle deficiency. Now I was shocked. I mean, I was never trained as in medical school. Most doctors don't know this. But the muscles produce certain chemicals when they are activated or when they are stressed. They produce certain chemicals that get into the bloodstream and go to the brain, where they do a lot of things, including improving synaptic activities, protecting the brain, including increasing energy levels in the brain. So people who are not active or who don't have enough muscle mass. Another thing about the muscles is like it serves as a reservoir for the chemicals your immune system needs, the chemicals your brain needs. So if there's damage to any part of your body, the amino acids, which are the building blocks for your bones and your teeth and your muscles and everything, are gotten from the muscles. So the body basically takes out of this reservoir and uses it to repair damage in the body. So the more muscle mass, and I'm not talking about the Arnold Schwarzenegger kind, I'm talking about just simple muscle. The more muscle mass you have, the healthier you will be. We used to think this only applied to, jocks, gym bros and all that. We're now finding out that this is so important. So it's really important to pay attention to this. And the sad thing is that the older you get, with every passing decade, that loss of muscle mass accelerates. And if you're always sitting down at home and not moving at all, that acceleration is even greater. Obviously, if you have a disease like diabetes, it even gets worse. So by 80, most have lost 30 to 50% of their muscle mass. I'm going to talk about nutritional deficiencies now. So these are the common deficiencies that we see in women. Iron, obviously, because of the monthly periods, iron is very important for the brain. However, I really hesitate I never recommend iron, because too much iron in the body too, or in the brain, they are now beginning to point to dementia as one of the problems with just taking iron supplementation. Two things that I never supplement. I never supplement with calcium. I never supplement with iron. Okay, because those things can increase, can cause calcium in particular can cause cardiovascular cardiovascular stiffness in the blood vessels. Women are deficient in vitamin D. Magnesium is super important for the brain. The B vitamins, super important. Choline, some say it's a B vitamin, omega-3 fatty acids. Some of it is because of lifestyle. Some of it is because of your eating preferences. Women tend not to eat as much meat and animal food. There are more vegetarians. I don't know what the ratio is, but I think it's significantly higher among women than men. So these are all nutrients that your brain must have, and that's the point I'm trying to make. So this is another table just kind of showing the implications of low iron, low vitamin D, and so on. I guess you're going to get those slides. Another thing is cardiovascular disease. This again is shocking. Sorry, I'm laughing. But so I listened to a TED talk by a cardiologist, and she's like, "You people have neglected us." And so she's leading the way, trying to get more research being done on women. The standard research approach was just to study men and just assume that what applies to men must apply in women. We are now finding out that when it comes to cardiovascular disease, now again, estrogen is very protective of the cardiovascular system. Don't worry, folks, I promise I will give you some good tips on what to do about these things. But we're now finding out that the way the woman's cardiovascular system operates, especially when it comes to plaque formation, is very different from the way the man's blood vessels operate. So the treatments have all been geared towards men, and simply assuming that it works with women. And because of that, they are unable, many times they miss developing problems in the woman's cardiovascular system as opposed to the men. So this is a perfect example. With men, the plaques are very obvious, so they can catch them on the scans. With women, less so. In fact, in some cases, this yellow thing you're seeing, which are the plaques, is actually in the walls, or just outside the walls. And so the typical standard detection processes miss these things. That's why you see women dying of cardiovascular disease. Now, up until menopause, they're protected, but after that, because of the estrogen levels, they are not. And so they're not caught like they should. Another thing I just want to point out too is toxins. So now that's a lifestyle thing. So sometimes women tend to, I mean, you gotta look pretty, right? But there are now studies showing that these especially when you want to dye or straighten your hair, it's over a long period of time, there's chemicals can actually cause cancer problems, endocrine problems, and anything that affects the endocrine or the hormones affects the brain as well. So we want to be aware of those things. All right, so I think, yes, so I've depressed you long enough. Now it's time to go into the solutions, hopefully. There are two main aspects: preventing dementia, and also what to do if your loved one already has dementia. Okay. Yeah, sleep. Just quickly say sleep. Women tend to not sleep as well, so that needs to be addressed, and I think I'm going to talk about that in this next slide. And I apologize for rushing through this, but I mean, as you can see, there's a lot of work to be done. A lot of each topic in this whole woman's diet is at least an hour and a half to really treat it properly. So these are just highlights. You can of course go to our website, and I think I have on my YouTube channel too. I talk about certain things. I am working on a course called Keeping Your Marbles, which is you like that? Where we kind of like go through practical ways you can do just that. All right, so these are the I think the ones highlighted are the ones I'm going to talk about. Excuse me. All right. Here in the U.S., so I would recommend. So you see this green line here. This is what happens if you have a good doctor or healthcare professional who knows what they're doing, they can help to not only reduce that decline if you start early enough, but they can significantly improve your energy levels. So you end up in your 90s with 76% as opposed to 65%. A lot can be done, especially in the right hands, to help significantly improve. But even if you passed menopause and in your 60s or 70s, hormones are still important for your brain. So done right, can significantly improve and probably even prevent things like osteoporosis and cardiovascular disease. So a lot needs to be said about that. I have this picture here. Why do I have this here?
You're at 25 minutes left.
You got 25 minutes left? Okay, good. Thank you.
You're welcome.
Anyway, so these are, I'm just gonna skip this. So what we do, there are nutrients and supplements that can actually, unfortunately you can't get them in food, but there are actually nutrients and supplements that are actually like raw materials. In our work, we provide these as nutrients, and the body now makes the estrogen and the testosterone and so on that the brain needs for health. Now, obviously, if you have access to a healthcare professional who knows what they're doing like that, like I said, they can actually find out where you are, what your levels are, and actually fine tune and tailor the treatment to you so that you can, you get it in the right balance. For osteoporosis, I honestly think one of the rules people should have, or these retirement centers that are popping up everywhere, one of the residents to be should sign some kind of contract saying that they will, if they're not going to do it, then they cannot be admitted. They will participate in weight training, especially where the limbs are concerned, because that can save you a world of hurt. Muscles require proteins. We're now finding out that animal proteins give you better quality proteins than just plant proteins. So I know most people don't want to hear that, but animal proteins actually they're now showing that they provide better quality proteins and amino acids. If you cannot eat animal protein, then there are supplements that can provide you with the amino acids you need. I also recommend creatine. Anybody heard of creatine?
Mm-hmm.
Okay. It's becoming a superstar in the aging community. It's very good for the muscles. It's also good for the brain. Vitamin D, pretty much everything you can think of, you should add vitamin D to it. If you can't get a scan, go ahead and get a scan done so you can know exactly where you are. You do not want to be walking around with osteoporosis, I promise you. And many people have no idea, so you gotta figure it out. Muscle mass. So the thing about building muscle is that it helps with the bones as well as the brain as well, like I said. So I was giving a dementia talk at the home sometime, and these two ladies walk up to me, both smiling. Jill on the left, and that's her mother, Janelle. So Janelle walks up to me and she does this, and flexes, and she's like, feel that. And I did, and folks, I don't know what else we talked about afterwards, but all I know is that I was saying yes ma'am and no ma'am. Anything you say, ma'am. Yeah, those guns were something else, I promise you. So, yeah, I do not. All right, so there's a new trend that the Alzheimer's Association did a study on, and they found out that they could reduce the risk of dementia by as much as 40%. Just one nutrient. Now think about that. There are about 120 different kinds of nutrients. They picked one that can reduce your risk of dementia. And for women, it was, and this is by supplementation. This is not in food. This is by supplementation. And they said in women, it was as much as 49%. So essentially 50%. Does anybody know what? Sherry, you cannot say anything. Does anybody know what nutrient that is?
Folic acid?
No.
No?
She said folic acid. Anybody else? Vitamin D3.
Wow.
One of the cheapest ever nutrients on the planet. Yes,
But
ma'am.
for D3, you have to have calcium as well to absorb it, don't you?
No, you do not. You do not want to be just taking calcium supplements.
No, I'm saying you have to take both, right?
No,
Don't you have to have
do not.
both?
You do not. What vitamin D does is that it helps you absorb more calcium from your food.
Right.
But once you start taking calcium,
Mhm.
there's a higher risk of deposition of the calcium in your blood vessels and causing stiffening. You do not want that. The fact that you're taking a calcium supplement does not mean it's going to the bones, or it's going to stay. In many cases, it just stays in the blood.
I mean, if you have additional too, you can, excrete it out, but, yeah.
Doesn't always work that way.
Okay.
So I strongly recommend, unless you're a weightlifter, you're very, very, very physically active, you can take calcium supplements. But for the most part, I strongly suggest people stay away from calcium supplements. Cardiologists have seen too that people who take calcium supplements tend to have greater stiffness in their arteries, right? So this
Dr.
is,
David?
yes.
Sorry, it's me.
Yeah.
Since we're talking about D3, I had recently heard something that it should be taken with a fat when you're eating in the morning or something. Just wanted to see if you had any insight on that.
It's a fat soluble vitamin, so it's more easily absorbed when you're eating on fat. But I tend to say, listen, the bottom line is you need to take it. If you now start putting stumbling blocks before people and they're like, oh, I haven't eaten yet, so I'm gonna pass for now, I mean, I've been taking it for years, and it hasn't been a problem. Without food, I usually don't have breakfast or anything. I take my vitamin D in the morning. I also take it in the evening as well. So, I mean, ideally, you are correct, but I just don't want it to be a stumbling block, okay? So I have about 7 nutrients that I always recommend. These are the ones that we have found out that tend to be deficient for most people, especially after 50. Here they are. These are also nutrients I use for my kids. The kids with brain disorders in Nigeria, we've used most of these. Even simple, it's crazy how these things work. Something as simple as magnesium. I'm doing a study now on a few of the kids there. We're just giving them magnesium for cerebral palsy, and they're seeing results. Drooling reduced, neck more stable, child's emotions are improving, and so on. So there's a if you want, you can get your phone out, the QR code. We send you to the exact brands that we use, because there are a lot of scoundrels out there who just put powder in a bottle and there's nothing to it. So these are the ones that we found that have been effective in kids. And these are all, I use all of these myself. So these are the exact brands that I use for myself. So you can get them off Amazon. Amazon keeps telling us they will give us a commission for everybody that we refer. I'm still waiting. We haven't got any money from that yet. So
There's several types of magnesium. So I've heard it's magnesium gluconate that you should take. What's your opinion on that?
Gluconate is really good. Yes, gluconate is good. Glycinate is good too.
Glycinate, okay.
Glycinate is good too. Then the one I use is gluconate. So toxins, I'm just gonna say you want to be more aware. No one is saying don't look pretty, but there are different apps now that tell you how much, what the burden is for certain kinds of toxins, whether it's skincare, healthcare, and so on. Now, what we do too is that we found out there are certain nutraceuticals, natural products that help remove heavy metals and toxins and all these things. I don't know about microplastics, but they help to remove these things from the body. We learn about them when we're working with kids with autism and other brain conditions. Very effective. So we basically, so it's part of my treatment protocol, especially if I suspect that there's some kind of toxicity in this person's life. All right, so I'm going to end with this is the 4th part. Supporting those with dementia. Dementia is reversible. Most people don't agree with that, but it is. But there's always something, maybe on your own you cannot completely reverse it, but there's something you can do to help your individuals. Like I said, this is our approach. It's we attack it from several different angles at once. It's costly, it's not covered by insurance, unfortunately. But I tell people in the long run, you're spending a lot less with us if you add up all the different things you have to do for your parents or your loved one, or your loved one with dementia. It's significantly more expensive. So what we do is a fraction. We can do it in we get results within a month. And usually I like to have my patients patients or the loved ones, I like to get them off off my treatment within 6 months. I just tell them what to do going forward, because during that 6-month period, we've achieved a significant amount of progress. So your number one priority obviously is energy levels. So if you're helping somebody with dementia, I would say of the 7 that we mentioned, the ones highlighted are the most important. And you probably need more higher doses than what is on the label. And I'm just gonna leave it at that. Before I get in trouble. You also want to consider, I mentioned creatine. Melatonin is not just a sleep supplement. They're now looking into using higher doses, much higher doses. So on average, they say you take about 3 grams to 5 grams of melatonin if you can't sleep at night. For some of my patients, I use 40 grams. Other in some studies, as much as 70 grams. 70 grams.
Jeez, I thought I was being risky by taking 10.
I take 30.
Okay.
I take 30 at night, and I've been doing this for years.
Yeah.
So yeah, it's because it's not just a sleep, it helps with repair
Right.
of the brain. But I was shocked as I get into kids and to older women, they would come back and say that, oh, my memory is better now, just on melatonin. It's amazing what is out there. And I would never have figured these things out if I wasn't desperately looking for things that were cheap that could help these kids with brain disorders. I mentioned sickle cell disease, for instance. Sickle cell disease, it kills people, most people by the age of 5, 75% are dead in Nigeria. Now we're shutting it down, and people are living these kids are living pretty much normal lives. They're going back to playing soccer and so on. All right, so let's see what we've learned. I said a few things here. I'm going to recommend a few things. So 7 steps. So I'm going to try to capture the essential things you want to know. All right.
13 minutes.
13 minutes, thank you. Declare all out war against sugar. I know I'm being a little melodramatic, but high levels of sugar without counterbalancing it is one of the great killers of the brain, in addition to ultra-processed foods. So you want to go more natural as much as possible. If you must take sugary things, you need to be more active, and you need to counterbalance the effects of these sugary things by taking supplements. How many of you are taking supplements? Good. It should be the whole class. There is no pride, I promise you, unless you're endowed with genes from a planet called Krypton. The world is very different from the world your mothers and grandparents lived in. Very different. In other words, the threats to your health are so much greater. So you need health. You cannot just rely on having a balanced diet, or whatever that means. You need more than just a balanced diet, and you need more than just exercise. You need help. So I'm just going to leave it at that. Women, you can find a trainer to show you what you need to do on a regular basis. I suggest you do that. Get more exposure to nature. Have your blood levels checked. There are a series of tests that I recommend for brain health, and we can't go over that now. If you are to take one supplement, it has to be, I would recommend D3K2. And of course, you need to increase your protein intake. If you want to do a deep dive, I also do consultations. I walk hand in, so obviously there's no such thing as a cookie cutter approach. I do a consultation and then I kind of like give you a guideline on what you need to do going forward. And most clients just work with me one-on-one, so on a monthly basis. They pay me like a retainer, and then I work with them and basically guide them through, either if it's concerned about their brain, concerned about menopause, concerned about sleep, I help them find solutions. Keeping Your Marbles is something that this is my baby, my project. It's all about helping you do what I mentioned at the beginning, helping you take control of your brain health. And the analogy I use every time is that think of your brain as within a fortress, right? Then you've got the moats and the protections. Activities go on within that fortress, whether it's reproductive, money-making, business, and so on. This is what keeps a thriving community, but it has to be protected. there are certain, and then there are attacks. So obviously you can't see them in this picture, but there are attacks, whether from within or without. We help you identify what those attacks are. We also help you identify where your defenses are, your brain's defenses. And it's not just in the brain, it's in the body as well. And we show you what you need to do to strengthen those defenses and reduce those attacks. And we show you what an objective way of keeping track, so that you know that you are on the right track. You know how people say, oh, I've done everything I know to do. Well, it's rarely true. You probably didn't know everything you needed to do. So we help really tailor these things. Like I said, black people are different, white people are different, women are different, veterans are different. Depending on your occupation, you are exposed to different risks. So we help you identify those things. And we use a lot of pictures. If you are interested in knowing about when the course is going to start, there's a QR code, so you can just indicate your interest. Not asking for money, just indicate your interest so we can know how to follow up. I usually, before the course begins too, I also ask a lot of questions. I interview people, what would you like to see? Or what questions would you like to have answered in the course? Okay, numbers, this. All right, this is what I said earlier. Just want to reiterate, it all comes down to energy, brain energy. If you can increase brain energy, you will be the better for it. So I want to say thank you again to Linda and CMSA for your support, and I hope you had a good time listening to this.
Thank you. Can you elaborate, and you may have, would you mind showing where the studies came from again? Just so that we can scan, and I apologize, I had to step out for a bit, but, and also, did you touch on, the amyloids in the brain causing the dementia? Years ago, they used to say it could have been from aluminum, right, which came from our cooking pans. And I think even just this week, they talked about, the fact that those forever chemicals and the PFAS in the nonstick pans is contributing to it.
Yeah.
What's your thought process on that?
Well, like I said, that last part falls on the toxins. So toxins can come from different areas. Yes, so PFAS, aluminum, forever chemicals. Yeah, I personally don't think that is. I always think that's a combination.
Well, I was gonna say, it's probably not a sole contributor.
Correct.
That's why it contributes to it, but, okay, all right, thank you.
Sure.
Any questions?
Any other questions?
I mean, you asked about the amyloid plaques as well.
Yeah.
I think I kind of mentioned too that amyloid plaques seem to be an effect rather than a cause.
Right.
So what we're doing is that we're blaming the ambulance.
But what causes the amyloid plaques right? So that's the question, is what causes the buildup of those amyloid plaques? Is it something that's in aluminum? Is it something that we're ingesting? It has to be something we're ingesting, because we're seeing far more of it.
Yeah, so amyloid plaques are formed, amyloid is formed in the brain normally.
Right.
So it's formed in response to infections, toxins, so it's like it's part of your brain's immune system. So
Right.
what happens is that maybe the toxins, it might get out of hand, it's not removed like it should, as a result of something that's,
Yeah, I mean,
or
it's
even sleep problems.
right, it's no different than like the kidney, right, where with the kidney, toxins that build up in the kidney that we don't excrete can cause kidney failure, right? So it's a similar kind of analogy for the brain.
Sure.
But what causes it is the question.
I thought I answered that.
No,
What causes the amyloid plaques?
Yeah, so it's a buildup of a bunch of stuff.
It's a buildup of the amyloid that's not well taken care of. By the way, they did a study, they've done several studies now, where they tried to guess who was going to have dementia based on the pathological findings of the amyloid plaques.
Right.
And over again, they couldn't get it right.
Yeah.
Because there were some who had a lot of plaques, and prior to their death, they showed no cognitive defects.
Right.
There were those who had not many. I mean, everybody has plaques to some degree.
Right.
But there were some that didn't have enough plaques to justify a cognitive problem, and yet they did have
Okay,
dementia,
Sure.
full-blown dementia.
sure. And there is a question in the chat.
Yeah,
If
we have a
could-
couple more here,
Okay,
and we'll get to
all
that.
right.
Thank you, Dr. David.
Yes,
Quick
ma'am.
question. Any studies that you're aware of dementia women who've had surgical menopause versus women who have progressive menopause?
As in progressive, you mean by normal?
Normal
Normal menopause.
menopause, yeah, in
Yes.
terms of decrease of estrogen over time.
So two things, quick question. Surgical menopause means they remove the ovaries and the uterus. Higher risk of dementia. There are studies that show that. I don't have that with me over here, but yes, significantly higher. Also, those who have had a longer perimenopausal stage, in other words, they started having symptoms maybe 12, 13, maybe started having symptoms at 35, as opposed to about 40, 41, 42. Those ones too have a higher risk of developing dementia for some reason. It's all a question of the length of exposure to that deficit in estrogen. The longer your brain has been exposed to that deficit in estrogen, for example, progesterone too is important, the higher the risk of developing dementia.
I have two questions.
Yes, ma'am.
One, I was low on magnesium, so I started taking hemp seed and then my iron increased.
So what's the question?
Huh?
So what's the question?
So, I guess was I taking, like, is hemp seed so rich that it increased the iron but balanced the magnesium?
Yeah, I don't know.
Okay.
I don't know about hemp seed and iron, but
Okay.
yeah.
And then my other question is, there is this new doctor and she's been creating a lot of different vitamins and it's called Black Women Vitamins. Have you heard of them?
I have not.
Okay.
Is that what it's called, Black women vitamins?
Black Women Vitamins, yes.
I would love to know more about them because, yeah.
Yeah,
I'd
so,
like to see.
okay, I thought I'd ask you and see if you, what you thought about that. It's not.
Hey, I mean, if you can tailor your formulation to address certain demographics, I'm all for it.
Okay.
Okay, I know we have one question, at least one in the chat.
Question from the chat is, what is your take on brain support supplements such as Prevagen?
I don't use it. I've used it for myself once before. People who I've spoken to didn't really get great results from it, so that would not be in my top 10.
And how much omega-3 is recommended?
Between 2 and 4 grams a day.
Thank you.
That's for healthy people, like I said. Once you're dealing, so this is another thing I didn't mention, but people need to be able to know how to respond to certain life stressors or life events, okay? So it's very important, like for instance, if you've had like someone loses a loved one, for instance, that's a great stress, especially if you live there for 30 years or so. That's a great stressor on the brain. That person, in addition to getting therapy or whatever, they should be taking a lot of things like omega-3s to help to reduce the inflammation that is, or the damage that is certainly happening as a result of that grief process. Same thing with divorce. I'm going to be speaking to divorce attorneys next month. Divorce itself is a great stress on the brain and it's causing damage to some degree. So what can people do to mitigate or reduce the effects of that damage? Another example are football players. These people are constantly getting trauma to the brain. Their brains should literally be swimming in omega-3s because that's what helps to save and reduce the damage.
You mean not the bigger helmets?
Not the bigger helmets. I mean, there's only so much helmets
That's
can
right,
do,
exactly, right?
There's only so much, yeah.
Well, Dr. Ajibade, I can't thank you enough for this today. It's been wonderful. On a personal note, I am not going to let anybody shame me about 20 milligrams of melatonin, and tonight I'm taking 30.
I was like, ooh, yeah.
Hey, if you're drowsy in the morning, you got it.
Let's give it for Let's give it up for Celinda. Let's give it up for Celinda with 30. I'll call you in the morning.
So everybody online, if you could please be back at 12:20. We'll have some sponsors to talk with us, and then our second speaker, Dr. Tahan, starts at 12:30. Thank you.
Thanks.
So thank you all. We have pizza in the back, pizza and salad. There's cheese, pepperoni, and a veggie pizza back there. So please help yourself and different drinks and other things along those lines. And then, of course, we've got our sponsors, and if you please stop by, talk with them. You know, we really appreciate showing them a little bit of love for helping us put on this event.
And I apologize, I had to step out.
Thank you.
What about like an amenda, and because,
It's good.
so background, I do critical care at.
Sorry, let's turn this off.